traditional owners of the lands on which we meet today and pay my respects to the elders past, present and emerging. Firstly, I'd like to thank everyone for coming today to these virtual open days, and I'll introduce myself as well. So I'm Michelle and I'm a MNHS student here at Monash, and today I'm chatting with some of our medicine and biomedical science students to find out a little more about their degrees and what it's like to study at Monash University. So with us today we have Monash Puri, who is studying a Bachelor of Medical Science and a Doctor of Medicine via direct entry. We have Shazma Mirani, who is also undertaking the Bachelor of Medical Science via grad entry. And lastly, we have Claudia Shen, who is completing a Bachelor of Biomedical Science as well. So I'll invite each of our students to introduce themselves, and if we could please start with Monash.
So hi everyone, my name is Monash Puri and I am a second year medical student at Monash University. So I'm in my second year of my undergraduate medicine degree. So a little bit about me and who I am. I guess the reason why I've decided to actually do medicine here at Monash University, I guess the biggest main reason is because of the fact that it's the only direct entry pathway that we have in Victoria for medicine specifically. So obviously that is quite advantageous in terms of time. But there are also a number of different reasons why I guess Monash University was the right pick for me. Firstly, definitely the clinical focus, in a sense that right from the outset, from year one, we have a very strong clinical perspective and outlook, in whatever we're studying. So, whenever you're studying science or whenever you're studying, different aspects within your medical degree, you're always looking at the end of the day, how is it going to affect the patient, or how is it going to affect the patient's overall outcome? So I think that's something that I really admire about our degree, and the fact that we always come back to why it's important or relevant clinically. But also I enjoy anatomy as well. So I love, dissection and specimens. And although we didn't get to do much of it this year because of the lockdown, how we were able to consolidate this last year was very, very handy and very helpful and great to see in live person. And so I guess those are some of the things that I love about, my degree in itself. And also, I think the direct entry, it's a smaller cohort than a lot of the other degrees here at Monash. So you do have a lot of the classes with the same, people. So you do get to know a lot of the people in a lot more depth, and, really it's a lot easier to actually build those connections, those friendships. And it's kind of like we're all in this together sort of thing. It's a definitely a difficult degree in terms of the workload that you have, but it feels really nice to be like, okay, I have people with me who I am doing this degree with, so that's really, really good as well. And I guess in terms of stuff outside of medicine, so obviously there are a number of extracurricular activities that that you can do. So some things that I'm a part of, number one is the Curie undergraduate research program. So that's basically where undergraduate students get the opportunity to formulate their own research about a specific topic that they're interested in. So with the group that I'm participating in, it's about COVID-19 and cardiovascular disease. So it's quite pertinent to what's out there at the moment, and that's why it's quite interesting. And you can obviously do research in any topic. Yeah, so that's a little bit about me. In terms of placements, for this year, they have been cancelled for us. But last year, I did get the chance to go and, for a short period of time. I think it was like 1 day in a hospital, 1 day in a GP placement. But nevertheless, it was very enjoyable. And it was, I guess, a snippet of what's to come for us in year 3, year 4, and year 5. But yeah, overall, great degree in the length, but also the clinical exposure that we do get, and great support as well.
Thanks, Monash. Great insight there. Could we move on to Shazma, and could you tell us a little bit about your degree?
So a little bit about myself, my background. So I'm in the third year of the four-year graduate entry program. And before entering medicine, I did a Bachelor of Science in Molecular Biology, as well as a graduate research degree in Immunology and Infectious Diseases. So for the reasons why I chose to apply to Monash and attend Monash for medicine, it was kind of going off what has been already said about the research accolades that have been associated with Monash. There's a lot of great research that's being done in the areas that I'm interested in terms of infectious diseases. And that's one of the things that drew me to Monash. In terms of what I really love about the degree at Monash is the fact that you get a lot of clinical experience. So for 3 years of the four-year degree, you're in hospital in the graduate entry program. So you're interacting with patients, you're talking with other doctors, nurses, and you're learning through experience rather than just learning from a textbook or someone's just lecturing to you. And that's I feel like I learn best in that type of environment when you're kind of enveloped in this type of in like the medical field itself in real life examples. In terms of the placements, so in the second year of the graduate entry program, you do placements in hospital and you're there for the whole year. And you do general medicine and surgery. So you get exposed to a lot of interesting cases like pneumonia or like hernia repair and things like that. And you really get involved with the medical team in terms of seeing how they make decisions, getting a little bit of clinical experience in terms, you collect bloods and things like that. In the third year that I'm in now that you get a little more comfortable being in hospital, we get put into different areas in the hospital as well. So there's psychiatry, pediatrics, obstetrics and gynecology, as well as in GP clinics around the city. And yeah, overall, it's a really great experience. You get to learn a lot. And it's really fantastic to see how the consultants and everyone in hospital is really they create a really great learning environment, which has been really wonderful for sure. One of the things I was want to talk about is like some of the challenges that you face when you're in the medical degree program. And I think each degree, no matter what you do, you'll have challenges for sure. And in particular in medicine, I think one of the things is that you face a lot is kind of doubting yourself in terms of, dealing with the workload and trying to, balance out your life with everything. And for that reason, it's really important to have like a good support network. So having those friendships with other people in the program who are facing the same challenges as you, has been really great. So although I'm in the graduate entry program, we get combined with the direct entry students as well in our second year. And so we all combine together, we all have our strengths in different areas, and it's been a really supportive kind of environment that I've really appreciated. As well as extracurriculars. So it's really important in medicine, you're not just in school all the time and being involved in other things. So personally, I'm really interested in research. So I'm a senior editor of the Australian Medical Student Journal. And that's a peer-reviewed publication where we publish research conducted by medical students. As well, I'm part of the AMSA, which is the Australian Medical Students Association, where I advocate for international students in terms of helping them deal with challenges they're facing as international students. And thank you. Sorry, I think you're on mute.
Sorry, was I muted? Can everyone hear me? Can I get a thumbs up or something? Thank you. All right, so thank you, Shazma. Sorry about that. We'll move on to Claudia, and she's studying the Bachelor of Biomedical Science.
Hi, so my name is Claudia, and I'm a second year undergraduate student studying biomedical science at Monash. And the reason why I chose to study biomedical science at Monash was because I always had an interest in studying about human biology, especially about public health, and how that plays a part in kind of shaping the healthcare system and our society. One thing I really liked about Monash, which played a part, which drew me into applying here, was like the friendly and open community at Monash, at the Clayton campus, when I went there during open day about 2 years ago. And I thought this environment really suited towards my personality and what I really wanted to get out of my uni experience, which is why I applied there. And the things that I love about biomedical science is that you get to explore a diverse range of subjects related to human biology, such as neurobiology, developmental biology, and biochemistry, which gives you a chance to experience and learn about different things about the biological sciences. The lecturers and the staff there are always passionate about talking about their research and are always willing to discuss more to students, which really inspires the whole cohort into doing well. Another thing I really like about my degree is the large amount of support that the course provides in supporting your professional development, providing research placements, but also support in caring about your health and well-being. During my time at Monash Uni, I've participated in many extracurricular activities, such as joining the Biomed Society, many different clubs, such as the Monash Outdoors Club, and also the Permaculture Club, which is a gardening club at Monash, and also becoming a biomedical science student representative and a peer mentor. In a way, these activities really allowed me to enhance my learning experience by engaging with events, projects, outside of the traditional classroom setting, but also making more friends at Monash, which really developed my support network. So currently I have not undertaken any placement yet. However, I will undertake a placement through the biomedical science faculty with partnering companies in the upcoming summer that is optional to your coursework. And the challenges I faced during my studies was mainly adjusting to the larger amount of freedom I had within my coursework than I had in high school. So if I was unsure about what elective units I could do, I would always book a quick course advice appointment with the lovely biomedical student service team that was always available to help. Thank you.
Thanks, Claudia. So thank you everyone for those introductions. It's really great to hear about the community as well as the content aspect. So we'll move on now to the Q&A sessions, and I'll just check for some questions. So the first question that I've got is for the direct entry medicine. So I think that's for Monash. So a lot of students want to become doctors, but not many get in. What do you think makes someone a good doctor, and what's important to consider when you choose this career?
Well, I think it's a very true point that you've made, Michelle, in the sense that, a lot of people actually end up applying and, it doesn't obviously necessarily work out for everyone. And I think the first thing, when you are thinking about whether, medicine is an option for you or not, is to, I guess, think about it personally as to what is your personal reason for actually, wanting to become a doctor in the first place. And, a lot of the times when I've, spoken, with different types of people, they would, or, students that I've had in the past, they would say something like, I really want to help people, or, I just want to, find a way to actually help people by becoming a doctor. But the reality is that, there's so many different ways that you can help people, not necessarily just by becoming a doctor, but there's obviously, a huge number of avenues that you can actually take, which at the end of the day, you would be helping people out in one way or the other. And so I think one of the biggest, things to think about is, first of all, what's your personal reason? You know, what's your sort of personal story or touch that you're bringing along that would actually explain why you're wanting to do it. But I guess in terms of why you want to be a doctor, I guess it's a combination of not just wanting to assist and help people, but also having a passion and wanting to advocate for patients and, you know, what their treatment and is like, but also, I guess, a passion for science or anatomy, as well as the clinical side of medicine as well. So actually having the confidence and enjoying interacting with patients, you know, from day to day, because at the end of the day, that's what medicine is. It's a combination of both, not just, you know, wanting to study and actually learn, you know, science or the content behind it, but actually how am I supposed to translate the science into helping people? That's also a very key aspect that needs to be taken into consideration.
Yeah, very true. Thanks, Monash. So I have another question for Shazma. This one is about the grad entry medicine pathway. A lot of people tend to get worried about not getting straight into direct entry. So what could be some positives of the graduate entry?
I feel like there's a lot of advantage of doing the graduate entry program. By doing another degree before you enter, you get a lot of chance about like learning to adapt to how teaching works and at the university level, and having that time to kind of explore your learning styles, develop relationships with your classmates, because they're the ones that will most likely be with you in medicine as well. So you just have that extra time to develop those relationships. You get experience in different things. So as Claudia and Monash have really done well, is being really involved in different aspects of the university through clubs and organizations. And I feel like that's going through the graduate entry program. You have those extra years to learn a little bit more about these different fields. You get to learn about what's of interest to you in medicine or anything else that might be related. And you also you get to take courses that are not medically related that you find interesting. So for me personally, I took a lot of sociology and criminology courses. And even though I wanted to go into medicine, I didn't think they'd be very helpful to me. But now that I'm in psychiatry and learning about that, I realize that those courses were actually really helpful in kind of putting things in context for me. And I think that, I think everyone can adapt differently to the situation, but I think it's really about taking advantage of the situation you find yourself in.
Thanks, Shazma. I have another question here. This is for the Bachelor of Biomed, so for Claudia. This one is, what do you study in biomedical science? So for example, what sort of subjects, I guess?
So in biomedical science, we learn about how different diseases occur and how this translates and affects the human body, and the molecular mechanisms and chemistries involved. So mainly we learn about human anatomy, neurobiology, public health, bioinformatics, which is basically the study of proteins within our bodies and how this can be used to improve current treatments. We also learn about genetics, immunology, physiology, and how we can also disseminate the information that we learn from trials or experiments, and how this can improve the current literature and treatments.
Yeah, so a lot of things are covered in there. I have another question for the direct entry. So again, for Monash. It's a similar question. So what do you actually study in the direct entry medicine?
It's a very good question. So basically, so the first 2 years is preclinical. So obviously we're on campus. Well, at the moment, I'm not in campus, but usually, obviously, you would be on campus at Clayton. And so for the first semester, it's a lot of biology and biochemistry focus. So if you obviously done biology in school, so you'll be going through a lot of the similar topics. as what you've already covered, but obviously an extension to that. And then from second semester of year 1 onwards is when you start doing different body systems. So when I refer to systems, I just mean like different, I guess, systems of the body. So for example, you'll be looking at the cardiovascular system, which is the system of, the heart and its vessels, or your upper limb or lower limb. And that's how you're basically going by. So you'll be going from system to system to system of the entire human body. And then within that system, you'll be looking at different subjects. So for example, you'll be looking at the anatomy of it, the pharmacology of it, or you'll be looking at the microbiology and behind that, or the clinical skills aspect to it. So these subjects that I've just mentioned, there's a few more obviously, they're obviously, you're going to have them since day 1. However, it'll just depend on what system you have at that time.
Thanks, Monash. I have another question here for Shazma. It's, what if I can't get into medicine, even though the graduate pathway, but I'm really passionate about helping people? What other careers are there for me?
I was in this situation. I applied to medicine for the first time and I got rejected. And it's really heartbreaking, but I think it's all about kind of thinking about, if you really want to do medicine, there might be other ways for you to get in. So I think that's just something to keep in the back of your mind, that there's always another chance for you to apply again. But in the meantime, I feel that it gives you time to think about why exactly you wanted to do medicine in the first place, and kind of determining what kind of career path you want to go from there. So for me in particular, I really liked the aspect of like learning how vaccines are developed and how that can help in general health. So that's how I got into research, and that's a way of helping people, and that's a career path. You can go into graduate research programs and take that path if that's something of interest to you. For others, people choose medicine because they really like the interaction with patients, and I feel like there's like a lot of different areas you can go through that way as well. So I feel like nursing, occupational therapy, or even social work, they're all integral parts of people who work in a hospital setting. It's not just doctors that are running the show. There's all of these different people that have really fantastic skills that are contributing to the health of the patient. And I think that's something that's really important to consider, is if one of those areas would be more appealing to you, and to consider those options as well.
Thank you, Shaz. I think I have another question for Claudia. It's what other career paths are available besides medicine or research for the biomedical, finishing the Bachelor of Biomedicine?
So depending on your field of specialization and which field on the biological science you want to go into, biological research involves a lot of analyzing of results, use of laboratory techniques, equipment, and using and applying the broad range of knowledge that you've gained from your studies onto the many questions and problems you will encounter. So you would expect to do a lot of research writing, constructing research proposals, lab reports, and collaborating with a lot of different researchers in a range of interdisciplinary topics, whether it be in the wet labs, dry labs, surveying people out in the field, or being in the office writing up the proposals. Yeah. I think you're muted.
Yeah, I was muted again. Thank you so much, Claudia. I've got another question for you, Shazma. So how did you find the process of moving from one degree and then into another, into medicine?
I'm probably not the typical kind of situation of finishing a bachelor's degree and going directly into medicine. I had a very long stopover doing like research and things like that. But in general, just like the learning environment from an undergraduate degree to medicine, I feel like that's a kind of pathway that is pretty challenging. I feel like everyone in the cohort kind of had that challenge in terms of the type of workload and the time that you spend in hospital, in and teaching and preparing and doing teaching on your own or learning on your own. So I feel like that transition in terms of the learning styles and the different commitments you have, it's not just about going to lectures and labs. So that kind of transition and how you spend your time, I think that's one of the key things that you need to adapt to if you do choose the graduate entry program.
Thank you. I've got another question for Monash. So this one, I'm sure a lot of people will be curious. How was the GAMSAT or the UMAT for you? And do you have any tips for people planning to sit these exams?
So I did not sit the GAMSAT, so that was not a requirement. So for me, it was the UMAT, which I think is now the UCAT. But anyway, so that I think it was like a 3-hour exam for me or something like that. And yeah, so I thought that was a good, I guess from my vague memory, it's been what 2-3 years now, but it was stressful in the sense that obviously it's a 3-hour exam. Like, oh my gosh, how am I gonna sit through this entire exam? But I guess it's it's more testing about. It was more testing about your ability to actually apply different questions and understand and then apply to the questions that were available to you. So yeah, so it was definitely a challenge like anything is, but I guess if you put your mind into it, then yeah, you can definitely get do really well if you wanted to.
So it's really about focusing then. All right. So
focusing.
Yeah. I've got another question for Claudia. I think you did talk about placements a little bit, but could you elaborate on what sort of work placements that Monash has to offer in the biomed degree?
So there's many opportunities to connect with the industry and gain work experience. For example, there's the Monash Summer and Winter Research Scholarship Programs, which are available to help you in focusing on wanting to go into research. So, for example, the one that I'm going to do is called BME 2032, which allows you to contact and be placed within companies that work within health, public health, teaching, etc. And it provides a lot of invaluable experience in that you get to learn about different skills that you not necessarily learn within the traditional classroom, such as learning how to communicate with other people, disseminating information, and etc. There's also another research unit, I think that's in 3rd year, near the end of the year. It's called BMS 3990, where you'll be able to be placed into labs across Monash, such as the genetics lab, the cardiovascular lab, and etc. And yeah, it's basically extending your knowledge of research and getting a hands-on experience in working in those labs with researchers who are experts within their field.
Thanks, Claudia. We're getting close to the wrap-up time, so I have one final question for everyone, all our panelists. What was the highlight of your degree so far? And if you guys could give a brief answer. Thank you.
So I guess the highlight for my degree, I mean, as brief as I can make it, is just the whole community aspect that you have, that you're not alone in this. There's, so much support out there for you, and, really doing something that you enjoy at the end of the day, and really seeing, how we can, better the lives of patients, and how we can use what we learn in the classroom and, really translate that into a hospital or clinical environment.
For me, the highlight, I think, has been the ability to be in hospital and interacting with patients and their families. It's just really surprising for me to see that even when patients, they're going through this really hard, difficult part of their lives, but they're so willing to talk with you and tell you about their condition, and it's just really like an amazing experience to interact with patients and knowing that one day that we'll be the people that will be taking care of them. But in the meantime, it's just really great to have that opportunity.
For me, definitely, I'm really grateful for that. I'm able to experience a wide breadth of different sciences within my course, especially with just talking to lecturers or staff about their experience and their passion in working in that environment, and what drives them to improve the current literature and why they do their job.
Yeah, thanks, guys. So unfortunately, we're coming to the end of our session now, but I'd like to just thank all of our great panelists for sharing all their insight today. And if anyone is interested in medicine or biomedical science at Monash University, make sure to check out our booths there. And we hope to see you on campus